Our lovely patient who's 70 years old is status post abdominoplasty, brachioplasty, and thighplasty. So she's had she's had the full trifecta of body contouring. And she comes in today, she's about a year out from when we started, and she's very graciously agreed to share some of her thoughts and feelings about how this has changed her life.
This is great. I lost a bunch of weight, and so I was dealing with sagging skin, chafing, just generally uncomfortable. And what this has done over the last year is I now have no chafing. I have clothes that fit much, much better.
Nice.
And with the thighplasty, I've noticed a real change in my mobility. My balance is great. My gait is long and perfect and wonderful. And so if you're going through this journey, I would definitely recommend that you take it with Dr. Clater because he knows what he's doing and his staff is fantastic. The team is great.
We do have a great team.
You do. So thank you.
Thank you. So share with everyone, first of all, how you found us in the first place.
Well, I actually, many years ago, was a patient of Dr. Noon's.
Lovely.
And so when I started looking for folks to do it, I realized he was retired and he couldn't do it. But I looked at the practice again, and I was impressed with what I saw. And then independently, my dermatologist recommended Dr. Clater.
Oh, I like that.
And so, he had two going for him. So I came in for a consult, and I was all in for all this.
All in. And so now, between your tummy tuck surgery, your arm lift surgery, and your thigh lift surgery, which one has had the greatest impact on your quality of life?
Oh, definitely the thigh lift surgery because it's really affected my ability to exercise, to walk, to hike, to bike, to do all the things I really like to do. The others, I'm sure that when the summer rolls around and I don't have the chafing, I'll be very, very happy.
I love it. And at the age of 70, sometimes patients come in and they say, "Oh, I don't know that I'm a candidate for this." And I assured you that was nothing that was concerning. Was that in the back of your mind as you were considering undertaking all this surgery?
Yeah, and I asked you directly if age would have anything to do with it. I mean, and also a friend of the family just at the age of 82 had a facelift. And if he was up for it with no risk, I, who am generally very healthy,
you are.
I was a good candidate. And so I think that, age isn't just a number, but, talk to Dr. Clater about it if you're, up in years.
Yeah, I like how you put that. And so we did the tummy surgery at the hospital under general anesthesia.
Right.
We did the arms and the thighs here under local anesthesia. You were awake. Why don't you share with everyone what that experience was like?
The hospital experience was, quick in, quick out, good follow-up afterwards. And, general anesthesia is what it is. And, you're kind of gorked out for a while. Mm-hmm. The other surgeries, it was so simple and straightforward. I mean, I really like the awake surgeries.
Yeah.
They're good. I had a similar kind of surgery. I had a little thumb arthritis that was done under a local, and it just cuts down that period between, 2 or 3 days when you're really out of it. So that was good.
That's very true. I like that. That's a great analogy. Last question I always like to ask, is this something that you would recommend to a friend?
Oh, definitely. And as I know more friends who are losing weight with the GLP-1s, it's becoming an issue. Yeah. So I recommend it. Where I go to work out, people have noticed, and I have recommended it. So definitely, it's a quality of life issue, and I recommend it for anybody who's having the same kind of issues I had.
You're so lovely. Well, thank you for sharing.
You're most welcome.